Hey guys, it's Dr. Bang here with the Cleveland Clinic Chiropractors Group. I wanted to show you some tips if you have low back pain, almost like a little bit of a protocol, something you can do at home. So I had a patient just reach out to me. She said her pain was hurting on the left side of her back, kind of like in this lower area, but no pain traveling down her leg or traveling up her back. It was very localized. So what I want you to do first is get yourself a lacrosse ball or a hard massage ball, and we're going to do some direct kind of pressure right over that painful area. This is easy to do just by laying on a hard surface. Try to avoid like your couch or your bed, it's too soft, maybe like the carpeted floor. You're going to place that hard ball right on that painful area and just kind of ease onto it. You want your pain threshold to be like in that moderate area. Mild is not enough. Severe, that's too much. Just kind of like lift your hips up a little to relieve some pain. You want to push down on that moderate area and hold it for, let's give yourself like 30 seconds to kind of hang out on that spot. Okay? After you've done that about 30 seconds, we're going to move to our next part of the protocol. We'll do a couple of stretches. And for this patient, 4 of these stretches worked really well for her when I saw her a year ago. So I'm going to give you these 4. They won't work for everyone, but they worked great for her, so try them. And if they don't work for you, check out another one of our videos at the Cleveland Clinic Chiropractors Group and see if there's other alternatives that worked for other patients that could work for you. So she has a stretching strap that I recommend people use when they're doing these kind of stretches. First we'll start with the hamstring, so you're going to be feeling the stretch down through here and a little bit of the buttocks. Once you get to a good stretching position, you're going to give yourself some resistance. You're going to be pushing away from the stretch. I'm going to be pushing down. I'm going to be holding this for 20 seconds. After I make it to 20 seconds, I'm going to be trying to pull my leg towards my chest. I'm going to resist with this hand. And you can see I'm working pretty hard at doing this. You want to be putting in moderate effort into this area, into this stretch, And then you're going to push your heel, after 20 seconds pushing up, you're going to push back down 20 seconds. Sometimes it feels like the stretch has even gone away a little bit when you're pushing. That's good. It's quite all right. Then you pull up. And you're going to do like a cycle of 3. So 3 pushes, 3 pulls before you move to the next exercise. You'll really feel it through here. Sometimes some people will actually feel in their low back as well. Okay, once you've finished your 3 sets, pushing away, pulling towards, we're going to move to this stretch, which hits the IT band, tensor fasciae lata, some of the gluteus medius. My position's more like pushing this way, kind of pushing up and away. Hold for 20. And then this one's the opposite way is going to pull down this way, and I'm going to just use my back of my hand to resist my leg. My leg's pulling down, I'm pushing back. 1, 2, 3, 4, 10, 20. And then I'm back this way. You can see my right arm is holding my stretching strap, pulling it down, really deepening the stretch. Now I've done this 3 sets this way, 3 sets pushing in. We move to my next stretch. I don't need the band anymore. Drop that to the side. It's a pretty classic piriformis stretch. Crossing the hurt leg over the good leg. Reach behind. You're going to start to feel this a little bit higher up the buttocks. Piriformis buttocks, sometimes low back, sometimes hamstring. And then my direction of force is first I'm going to be pushing out with my knee. Push out really hard at moderate level. Hold it 20, 1, 2, 3, 20, boom. Then I'm going to be pulling my knee towards my chest and I'm going to be holding with my hand here. You feel it slightly different, but it's still working that same area. Hold that for 20. You're getting closer and closer, pushing away. Each time I'm finishing one of those cycles of pushing or pulling, I'm trying to get deeper into the stretch. do this again, 3 times pushing, 3 times pulling, alternating. My last stretch is trying to get this big muscle in here that connects from our hip to our spine called the psoas. Okay, I want to stretch my left psoas, so I need to lay on my right side. This, again, all of these stretches I would do on the ground, but I'm going to do it on the table so it's easier for you to see in the camera. So I'm on my right side, my left leg needs to go behind me. You're going to start to feel a stretch maybe here, maybe you'll just feel it right in the low back. It can be different depending on how tight it is. Then with my left arm I want to reach far. Okay? Now that I'm here, I need to add the resistance. I'm going to do that by bringing my right foot, putting it against my left thigh, and then I'm going to push with my left thigh forward. Give me that moderate resistance again. If it starts to hurt during any of these stretches, ease off the resistance, change your position slightly till it doesn't hurt very bad. A little bit of mild pain's okay, you're working through the problem. So I'm pushing forward for 20. Then I'm going to try to extend my leg backwards further and reach further for 20. And then I'm going to try to meet my right foot back against my thigh. Pull again, forward for 20. And back, good. All right, so now we've done some trigger point work with the ball. We've stretched it and some surrounding muscles. And the last thing I'm going to have you do is we're going to kind of just work the muscle with some exercises. Dr. Adams is going to walk us through how to do that protocol for that specific isolated low back pain.
So we're going to start in the all fours or tabletop position. So this is helpful to do on something that's a little more padded, especially if you have some knee problems. This setup is really important in that we want a nice stable base. You want your arm, if we're looking at this arm here, from the shoulder down, we want the elbow to be right underneath the shoulder and the wrist right underneath the elbow. So nice straight lines here. Sometimes people have the tendency of bringing this arm too far forward or too far back, so we want it right under the shoulder. Same thing for the knees, right under the pelvis, nice straight line here. Now, the idea of all of this is to keep the spine stable throughout this movement, so we don't want to see a lot of curving this way or bowing too much in this regard. We want it nice and stable, as we want stabilization through movement. So with the bird dog, what we're going to do is pick a leg. In this case, we're going to use the left leg. So if you're using your left leg, you're going to be using your right arm. Let's set up the leg first, and then we'll move to the arm. As we straighten out the left leg here, it's only going to clear the table or the ground by just a couple of inches. Quite often people make the mistake of raising this leg too high, which can again bring a buckle into the spine. So we want it nice and low, but stabilizing through the large gluteal muscles and through those low back muscles. In this case, again, where the left leg is extended, we're now going to extend the right arm, making a fist with the right hand and squeezing as high as possible. In this position, we're going to hold for approximately 8 to 10 seconds. At the conclusion of that, you're going to bring your right elbow and your right knee close together. Again, we want to keep this spine nice and solid and straight. This is our stabilization through movement. And then we return to the extended position. Again, the foot coming off of the ground just a few inches, fist on the hand, squeezing nice and tight as high as you can up, again holding for 8 to 10 seconds, and then we'll do another repetition of the elbow coming towards the knee, nice and solid, and returning to our extended position.
Yeah, watch for you don't do this when you come up. Like Dr. Adams said, keep your back straight so that your core spinal stabilizers are the only ones working. Okay?
Nice job.
And then we repeat on the other side.
And then we'll do the other side to bring symmetry to both sides. You may feel this on the affected side as being a little bit more difficult. If that's the case, if you found yourself just to be a little unstable, try it with just the leg. You don't have to bring the arm up as well, but one of the regressive positions is I can just use the leg for stabilization if you feel a little shaky or a little off, or if any of this is causing pain. So we want to bring it back just a little bit, and the real power of this movement is the stabilization through the posterior aspect in the erectors and the gluteal muscles.
So if I'm only doing it in my leg, would I still want to do this motion?
We still want that nice solid movement because we want stabilization through the spine. So yes, still do that knee towards the elbow direction and keeping nice and straight and solid through the low back. Very good.
Good. All right, so then you mentioned also maybe doing cat-cow.
Yep. So another spinal movement that we can do from the all fours position is what we call the cat-cow. Very common in yoga and other movement practices. From here again, we want to make sure that we have the proper setup of the all fours position. The shoulder, the elbow, and the wrist are all in alignment in a straight line down. From here, we want to focus on the low back, in this case because we want to bring some stability and movement to it, nice and easy. So we'll start with the first position, which is we're going to bring the low back as if it were going to droop down towards the table here. So it's just nice and relaxed, bringing into what we call spinal extension. And you don't have to hang out here, you don't have to push it here, it's just a relaxation. And then as we pull this up into spinal flexion, we're going to think about rounding the back. These movements are done nice and gently, we're not forcing anything, and it really is the action that is therapeutic. So you don't have to force anything through here. Now, if your pain is causing you increased symptomatology at the end ranges, simply cut this shorter. You don't have to drop down as far, you don't have to pull up as high. One of the things that we really want to stress here is pain-free range of motion, so this movement becomes therapy.
So what about like if I do this?
Once we
is that good or bad?
Once we force the spine into that position, what we want to make sure is we can get movement through here, but we don't want to push through with the arms and now make it a shoulder joint range of motion and loose side of the spine. Quite often you'll see as people really push through here, their arms will straighten out, the head tucks under, and now it doesn't really become a spine movement.
So we just want to focus on the lower spine movement, on try to keep everything else in position. So
exactly, keep it right in that motion. Also avoid, quite often what happens is people sink down here, they'll allow the shoulder blades and the shoulders to come up. Again, now it's this part of your back that's moving your shoulder and your shoulder blade, and not the small joints of the spine. Remember, those joints are really, really small, and we want to focus the movement right into that area.
Awesome. All right, so this is your first protocol to do between the massage ball, the stretches with resistance, and then this stabilization through movement. Check us out for another video if that doesn't work. Thanks.